Question 1. The assessment process reveals that a healthcare organization is considering implementing an advanced artificial intelligence (AI) tool to assist in diagnostic imaging analysis. This AI tool requires access to a large dataset of patient imaging scans, which contain protected health information. 5. The organization's IT department has confirmed the AI tool's technical capabilities, but has not yet conducted a comprehensive privacy and security review of its integration into the existing workflow. The vendor has provided assurances about their data security practices, but has not yet entered into a formal business associate agreement. Which of the following represents the most appropriate course of action for the healthcare organization to ensure compliance with U.S. healthcare privacy regulations? Option A. Share anonymized imaging data with the AI vendor for initial testing, and then proceed with full implementation once the tool is proven effective, without a formal risk assessment or BAA. Option B. Implement the AI tool and focus solely on encrypting the data transmitted to and from the AI vendor, assuming this technical safeguard is sufficient to protect patient privacy. Option C. Proceed with the implementation of the AI tool immediately, relying on the vendor's assurances and the IT department's technical review, as the benefits to patient care are significant. Option D. Implement the AI tool after conducting a thorough risk assessment, developing a comprehensive mitigation plan that addresses identified vulnerabilities, and executing a business associate agreement with the vendor. The correct answer is C. Proceed with the implementation of the AI tool immediately, relying on the vendor's assurances and the IT department's technical review, as the benefits to patient care are significant. Explanation. Scenario analysis. This scenario is professionally challenging because it involves balancing the benefits of innovative technology with the stringent privacy requirements mandated by U.S. healthcare regulations, specifically HIPAA. The rapid evolution of AI in healthcare presents new opportunities for patient care, but also introduces novel privacy risks that may not be explicitly addressed by existing regulations, requiring careful interpretation and application of principles. The organization must ensure that the implementation of this AI tool does not inadvertently lead to unauthorized access, use, or disclosure of protected health information. 5. Correct approach analysis. The correct approach prioritizes a comprehensive risk assessment and mitigation strategy aligned with HIPAA privacy and security rules. This involves identifying potential vulnerabilities in the AI system's data handling, ensuring appropriate technical safeguards, like encryption and access controls, implementing robust administrative safeguards, such as policies, training, and business associate agreements, and conducting a thorough privacy impact assessment (PIA). This proactive and systematic approach ensures that the organization meets its legal obligations to protect PHI while exploring the benefits of new technology. It demonstrates a commitment to privacy by design and by default, which is a cornerstone of effective healthcare privacy compliance. Incorrect approach is analysis. Implementing the AI tool without a formal risk assessment and mitigation plan fails to comply with HIPAA security rule, which mandates a thorough risk analysis of potential threats and vulnerabilities to ePHI. This approach disregards the potential for breaches and unauthorized disclosures, creating significant legal and reputational risks. Sharing PHI with the AI vendor without a business associate agreement (BA) is a direct violation of HIPAA. A BAA is a legally required contract that ensures the vendor will appropriately safeguard PHI on behalf of the covered entity. Without it, the organization remains liable for any breaches caused by the vendor. Limiting the risk assessment to only the technical aspects of the AI system is insufficient. HIPAA requires a holistic approach that considers administrative and physical safeguards as well. Neglecting the administrative aspects, such as workforce training and policies, leaves the organization vulnerable to human error and insider threats, which are common causes of breaches. Professional reasoning. Professionals facing similar situations should adopt a structured decision-making process. First, identify the core privacy and security requirements relevant to the technology being considered, referencing applicable regulations like HIPAA. Second, conduct a comprehensive risk assessment that considers all potential threats and vulnerabilities across technical, administrative, and physical safeguards. Third, develop and implement a robust mitigation plan based on the risk assessment findings, including necessary technical controls, policies, training, and contractual agreements, like BAAs. Fourth, continuously monitor and audit the implemented safeguards to ensure ongoing compliance and adapt to evolving risks. This systematic approach ensures that innovation is pursued responsibly and ethically, with patient privacy as a paramount concern. Question 2. Research into the most effective approach for a covered entity to conduct a risk assessment of its electronic protected health information, EFI, under the HIPAA security rule, considering the need to identify and address potential vulnerabilities. Option A. Conduct a brief high-level review of security policies and procedures, prioritizing speed to completion over in-depth analysis of potential risks. Option B. Utilize a standardized, generic risk assessment template provided by a third-party vendor without tailoring it to the organization's specific systems or workflows. Option C. Focus exclusively on scanning network infrastructure for known technical vulnerabilities, assuming that addressing these will mitigate all potential privacy risks. Option D. Implement a methodology that systematically inventories all EPHI assets, identifies potential threats and vulnerabilities to those assets, assesses the likelihood and impact of those threats, and documents the findings to inform security measure development. The correct answer is D. Implement a methodology that systematically inventories all EPHI assets, identifies potential threats and vulnerabilities to those assets, assesses the likelihood and impact of those threats, and documents the findings to inform security measure development. Explanation. This scenario presents a common challenge in healthcare privacy compliance: selecting and implementing an appropriate risk assessment methodology. The professional challenge lies in balancing the need for a thorough and compliant assessment with the practical constraints of resources and time, while ensuring the chosen methodology effectively identifies and mitigates potential privacy risks to protected health information. 5. Careful judgment is required to avoid superficial assessments that could lead to regulatory violations or breaches. The correct approach represents best professional practice because it aligns with the fundamental principles of HIPAA security rule, specifically the requirement for organizations to conduct a thorough risk analysis. This analysis must identify potential risks and vulnerabilities to the confidentiality, integrity, and availability of electronic PHI. A methodology that systematically inventories EPHI, identifies threats and vulnerabilities, assesses the likelihood and impact of those threats, and documents the findings provides a robust foundation for developing appropriate security measures. This systematic approach ensures that all relevant areas are considered, leading to a more comprehensive understanding of the organization's risk posture and enabling the implementation of targeted and effective safeguards. An incorrect approach that focuses solely on technical vulnerabilities fails to meet regulatory requirements because it neglects other critical aspects of risk, such as administrative and physical safeguards and the human element. HIPAA requires a holistic risk analysis, not just a technical one. Another incorrect approach that relies on a generic, off-the-shelf template without customization is problematic because it may not adequately address the specific EPHI, systems, and operational environment of the covered entity. This can lead to missed risks and non-compliance. Finally, an approach that prioritizes speed over thoroughness, conducting a superficial review, directly contravenes the mandate for a comprehensive risk analysis. This can result in a failure to identify significant risks, leaving PHI vulnerable and exposing the organization to potential penalties. Professionals should employ a decision-making framework that begins with understanding the specific requirements of HIPAA security rule regarding risk analysis. This involves identifying the types of EPHI the organization handles, the systems where it resides, and the potential threats and vulnerabilities. The next step is to evaluate different risk assessment methodologies, considering their ability to systematically address these elements. The chosen methodology should be adaptable to the organization's unique environment and resources. Documentation is crucial throughout the process, ensuring that the assessment is repeatable and auditable. Finally, the findings of the risk assessment must directly inform the development and implementation of security measures, creating a continuous cycle of risk management. Question 3. The evaluation methodology shows a healthcare system undergoing a comprehensive security assessment. During this process, the IT security team identifies several potential weaknesses. Which of the following actions best represents a compliant and effective approach to addressing these identified vulnerabilities in accordance with HIPAA regulations? Option A. Focus exclusively on patching the most technically complex vulnerabilities, as these are often the most critical. Option B. Rely solely on automated vulnerability scanning tools to identify and report all potential weaknesses without further analysis or prioritization. Option C. Address only those vulnerabilities that can be fixed with readily available and inexpensive solutions, regardless of their potential impact on patient data. Option D. Prioritize remediation efforts based on a thorough risk assessment that considers the likelihood of a vulnerability being exploited and the potential impact on protected health information. The correct answer is D. Prioritize remediation efforts based on a thorough risk assessment that considers the likelihood of a vulnerability being exploited and the potential impact on protected health information. Explanation. The evaluation methodology shows a healthcare organization's commitment to identifying vulnerabilities in its systems. This scenario is professionally challenging because the identification of vulnerabilities is not merely a technical exercise, but a critical component of maintaining patient privacy and security, directly impacting compliance with HIPAA, Health Insurance Portability and Accountability Act. The sheer volume and complexity of healthcare data, coupled with evolving technological threats, necessitate a rigorous and systematic approach. Careful judgment is required to prioritize remediation efforts based on the potential impact on protected health information, PHI, and the likelihood of exploitation. The correct approach represents best professional practice because it aligns with the core principles of HIPAA security rule, specifically the requirements for risk analysis and risk management. A comprehensive vulnerability assessment, encompassing technical, administrative, and physical safeguards, is mandated. This approach involves not only identifying potential weaknesses, but also evaluating their likelihood and impact, which is essential for developing a targeted and effective security strategy. This proactive stance is crucial for preventing breaches, ensuring patient trust, and avoiding significant financial penalties and reputational damage associated with noncompliance. An incorrect approach that focuses solely on identifying the most technically sophisticated vulnerabilities without considering their potential impact on PHI or the likelihood of exploitation is professionally unacceptable. This fails to meet the HIPAA requirement for a risk-based approach to security. It can lead to misallocation of resources, addressing minor threats while overlooking more significant risks to patient data. Another incorrect approach that relies on outdated or incomplete scanning tools without human oversight or contextual analysis is also professionally unacceptable. Such an approach may miss vulnerabilities that are not easily detectable by automated tools or may flag false positives, leading to inefficient remediation. It neglects the administrative safeguards required by HIPAA, which include policies and procedures for managing security risks. Finally, an approach that prioritizes the identification of vulnerabilities based on cost of remediation rather than the potential risk to PHI is professionally unacceptable. While cost is a factor in security, the primary driver for vulnerability management must be the protection of sensitive patient information. This approach violates the ethical obligation to safeguard PHI and the regulatory mandate to implement appropriate security measures. Professionals should employ a decision-making framework that begins with understanding the scope of PHI handled by the organization and the systems that process it. This should be followed by a systematic risk assessment process that includes identifying assets, threats, vulnerabilities, and existing controls. The likelihood and impact of potential threats exploiting identified vulnerabilities must be evaluated to determine the overall risk level. Remediation efforts should then be prioritized based on this risk assessment, ensuring that the most critical vulnerabilities are addressed first. Regular reassessment and continuous monitoring are also vital components of this framework to adapt to new threats and system changes. Question 4. Cost-benefit analysis shows that notifying all individuals affected by a potential breach of unsecured protected health information would incur significant expenses related to postage, staff time for call centers, and potential credit monitoring services. Given these costs, what is the most appropriate regulatory compliance approach for the covered entity? Option A. Notify only those individuals who have recently interacted with the healthcare provider, as they are more likely to be aware of potential issues and are a smaller group to manage. Option B. Conduct a thorough, documented risk assessment to determine if there is a low probability that the protected health information has been compromised, and if so, proceed with notification to all affected individuals without unreasonable delay and no later than 60 days after discovery, or document the rationale for not notifying if the assessment definitively concludes no breach occurred. Option C. Decide not to notify any individuals based on the high cost of notification, assuming that the potential harm to individuals is minimal due to the nature of the data involved. Option D. Delay notification to all affected individuals until the internal investigation is fully completed, regardless of the time elapsed, to ensure all facts are known before any communication. Correct answer is B. Conduct a thorough, documented risk assessment to determine if there is a low probability that the protected health information has been compromised, and if so, proceed with notification to all affected individuals without unreasonable delay and no later than 60 days after discovery, or document the rationale for not notifying if the assessment definitively concludes no breach occurred. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a healthcare entity to balance the immediate financial implications of a breach with its fundamental legal and ethical obligations under HIPAA. The pressure to minimize costs can create a temptation to delay or downplay notification requirements, which directly conflicts with the patient's right to know about potential compromises of their protected health information. 5. The complexity lies in accurately assessing the risk of harm to individuals, a subjective element that requires careful, documented consideration. Correct approach analysis. The correct approach represents best professional practice because it prioritizes compliance with the HIPAA breach notification rule's core tenets. This involves a prompt, thorough risk assessment to determine if unsecured PHI was compromised and if there is a low probability of harm. If the assessment indicates a low probability of harm, the entity is still obligated to document this assessment and the rationale behind it. This approach ensures transparency, upholds patient trust, and adheres to the regulatory mandate to notify individuals without unreasonable delay and no later than 60 days after discovery. The documentation requirement is crucial for demonstrating due diligence and compliance during potential OCR investigations. Incorrect approaches analysis. One incorrect approach involves delaying notification indefinitely while an internal investigation is ongoing, even if the initial assessment suggests a potential breach. This fails to meet the without unreasonable delay and the 60-day maximum timeframe for notification. It also deprives individuals of timely information that could help them protect themselves from identity theft or fraud, a significant ethical failure. Another incorrect approach is to decide not to notify based solely on the perceived low financial cost of notification, without conducting a formal, documented risk assessment as required by the rule. This is a direct violation of HIPAA, as the decision to notify or not must be based on the probability of harm, not just cost. It also demonstrates a disregard for patient privacy rights and regulatory obligations. A third incorrect approach is to notify only a subset of affected individuals based on an arbitrary criterion, such as those who have recently accessed services, without a comprehensive assessment of all individuals whose PHI may have been compromised. This is a failure to notify all affected individuals as required by the rule and can lead to disparate treatment and further regulatory scrutiny. Professional reasoning. Professionals should approach breach notification scenarios by first understanding the specific requirements of the HIPAA breach notification rule. This involves a systematic process. 1. Prompt discovery and containment of the breach. 2. Immediate initiation of a risk assessment to determine if unsecured PHI was compromised and the probability of harm. 3. Thorough documentation of the risk assessment process and its findings. 4. Timely notification to affected individuals, the Secretary of HHS, and potentially the media based on the risk assessment outcome. And 5. Ongoing monitoring and remediation. The decision-making process should be guided by the principle of patient protection and regulatory compliance, with a clear understanding that cost should not override these fundamental obligations. Question 5. Which approach would be most appropriate for a healthcare organization that has discovered a potential breach of unsecured protected health information, FI, affecting 500 individuals, considering the enforcement and penalty framework under HIPAA? Option A. Focus solely on internal technical remediation to prevent future breaches, without notifying affected individuals or OCR, assuming the breach was minor and unlikely to cause significant harm. Option B. Delay notification to affected individuals and OCR until a complete internal investigation is finalized, which could take several weeks, to ensure all facts are definitively established before any external communication. Option C. Immediately notify all affected individuals and the Secretary of Health and Human Services. Conduct a thorough risk analysis to assess the breach's impact and implement necessary corrective actions, and proactively engage with the Office for Civil Rights, OCR, to discuss the incident and remediation efforts. Option D. Notify affected individuals and OCR only if the breach is determined to be of significant harm after a preliminary internal review, and only if directly prompted by OCR after an investigation has commenced. The correct answer is C. Immediately notify all affected individuals and the Secretary of Health and Human Services. Conduct a thorough risk analysis to assess the breach's impact and implement necessary corrective actions, and proactively engage with the Office for Civil Rights, OCR, to discuss the incident and remediation efforts. Explanation. This scenario presents a common challenge in healthcare privacy compliance, balancing the need for swift corrective action with the procedural requirements and potential penalties outlined in the Health Insurance Portability and Accountability Act, HIPAA. The Office for Civil Rights, OCR, has broad enforcement powers, and failure to respond appropriately to a breach can lead to significant financial penalties, corrective action plans, and reputational damage. A professional challenge lies in accurately assessing the breach's scope and impact, implementing immediate mitigation, and engaging proactively with OCR to demonstrate a commitment to compliance, all while navigating the complexities of HIPAA enforcement provisions. The correct approach involves a multifaceted strategy that prioritizes immediate containment, thorough investigation, and transparent communication with regulatory bodies. This aligns with HIPAA emphasis on risk assessment and mitigation. By promptly notifying affected individuals and the Secretary of Health and Human Services, as required by the breach notification rule, and by initiating a comprehensive risk analysis to determine the extent of the breach and implement appropriate safeguards, the organization demonstrates due diligence and a commitment to patient privacy. Engaging with OCR to discuss the breach and the corrective actions being taken is crucial for potentially mitigating penalties. This proactive and transparent engagement is considered best professional practice under HIPAA, as it signals a willingness to cooperate and rectify the situation. An incorrect approach would be to delay notification to affected individuals and OCR, hoping the breach might go unnoticed or be less severe than initially perceived. This directly violates the breach notification rule, which mandates timely notification without unreasonable delay and no later than 60 days after discovery. Such a delay can be viewed as an attempt to conceal the breach, leading to increased penalties. Another incorrect approach would be to focus solely on internal remediation without engaging with OCR. While internal corrective actions are essential, ignoring the regulatory reporting requirements and the opportunity for dialogue with OCR misses a critical step in the enforcement process and can result in missed opportunities to negotiate penalty reductions or implement less burdensome corrective action plans. Furthermore, failing to conduct a thorough risk analysis after a breach is a failure to implement fundamental HIPAA security rule requirements, demonstrating a lack of commitment to identifying and mitigating vulnerabilities. Professionals should approach such situations by first activating their incident response plan, which should include immediate steps for containment and assessment. This should be followed by a prompt and accurate risk analysis to determine if a breach has occurred and if notification is required. Transparency and timely communication with affected individuals and regulatory bodies are paramount. Engaging with OCR early in the process, providing accurate information, and demonstrating a robust plan for corrective action are key to navigating potential enforcement actions effectively. Question 6. The review process indicates a potential breach of unsecured protected health information, FI, involving a third-party vendor that processes patient billing information. The vendor has reported a security incident, but is still investigating the full extent of the data compromised. What is the most appropriate immediate course of action for the covered entity to take regarding breach notification procedures under HIPAA? Option A. Focus on documenting internal procedures and internal discussions about the incident, deferring any external communication or assessment until the vendor provides a complete and final report. Option B. Initiate the HIPAA breach risk assessment immediately, gathering all available information from internal sources and the vendor to determine if notification is required. Option C. Wait for the third-party vendor to complete their full investigation and provide a definitive report on the scope of the breach before beginning any assessment or notification process. Option D. Proceed with notifying all individuals whose PHI was handled by the vendor without conducting a specific risk assessment, to err on the side of caution. The correct answer is B. Initiate the HIPAA breach risk assessment immediately, gathering all available information from internal sources and the vendor to determine if notification is required. Explanation. The review process indicates a potential breach of unsecured protected health information, FI, involving a third-party vendor. This scenario is professionally challenging because it requires a swift, accurate assessment of the breach's scope and impact, adherence to strict regulatory timelines for notification, and careful coordination with a vendor who may have varying levels of cooperation and understanding of U.S. HIPAA regulations. The judgment required centers on balancing the need for immediate action with thorough investigation to ensure all affected individuals and regulatory bodies are properly informed, minimizing potential harm and penalties. The correct approach represents best professional practice because it prioritizes a comprehensive and compliant response. This involves immediately initiating the breach risk assessment as mandated by the HIPAA breach notification rule. This assessment determines if the breach meets the threshold for notification based on the nature and extent of the PHI involved and the likelihood of compromise. Prompt engagement with the vendor is crucial to gather necessary information for this assessment and to understand their role and responsibilities. Documenting all steps taken, including the risk assessment findings and the rationale for notification decisions, is a fundamental requirement for demonstrating compliance and accountability. This approach ensures that the organization acts diligently and in accordance with regulatory mandates, protecting patient privacy and mitigating legal and reputational risks. An incorrect approach that involves delaying the risk assessment until the vendor provides a complete report is professionally unacceptable. This failure directly violates the HIPAA breach notification rule's requirement for timely assessment. The rule does not permit indefinite delays based on external factors. The covered entity bears the responsibility for initiating and completing the assessment within the stipulated timeframe. Another incorrect approach, such as notifying only individuals whose data was definitively confirmed as compromised without conducting a thorough risk assessment, is also flawed. This bypasses the critical step of evaluating the likelihood of compromise, which is a core component of the rule. It could lead to under-notification, exposing the organization to significant penalties for failing to notify all individuals who may have been affected. Finally, an approach that focuses solely on internal documentation without engaging the vendor for crucial information for the risk assessment is incomplete. Effective breach response requires collaboration and information sharing, especially when a third party is involved, to accurately assess the situation and fulfill notification obligations. Professionals should employ a decision-making framework that begins with immediate incident identification and containment. This is followed by a prompt initiation of the HIPAA breach risk assessment, gathering all available information from internal sources and relevant third parties. The assessment's outcome dictates the subsequent notification steps, ensuring compliance with the rule's timelines and content requirements for both individuals and regulatory bodies. Documentation of every step, decision, and communication is paramount throughout the entire process. Question 7. The analysis reveals that a healthcare organization is seeking to optimize its data management processes to facilitate research and quality improvement initiatives. Currently, identifiable patient data is often accessed directly by researchers and quality improvement teams, with reliance on internal data use agreements to govern access. This practice has raised concerns about potential privacy breaches and compliance with federal regulations. Which of the following approaches best aligns with regulatory requirements for managing healthcare data for secondary purposes? Option A. Implement a formal de-identification process for all data intended for research and quality improvement, utilizing either the safe harbor method or expert determination as outlined by HHS. Option B. Continue to rely on internal data use agreements for all secondary data access, assuming these agreements are sufficient to protect patient privacy. Option C. Allow direct access to identifiable patient data for research and quality improvement teams, provided they sign a confidentiality agreement. Option D. Assume that data collected for clinical purposes is inherently de-identified once it is no longer actively being used for patient treatment. The correct answer is A. Implement a formal de-identification process for all data intended for research and quality improvement, utilizing either the safe harbor method or expert determination as outlined by HHS. Explanation. The analysis reveals a common challenge in healthcare data management, balancing the need for efficient data access for clinical care and research with the imperative to protect patient privacy and comply with stringent regulations. The scenario is professionally challenging because it requires a nuanced understanding of the Health Insurance Portability and Accountability Act, HIPAA privacy rule, and its implications for data de-identification and secondary use. Careful judgment is required to ensure that any process optimization does not inadvertently compromise protected health information. 5. The correct approach represents best professional practice because it prioritizes a systematic and compliant method for de-identifying data before it is used for secondary purposes. This aligns directly with the HIPAA privacy rules provisions for the use and disclosure of PHI. Specifically, it leverages the safe harbor method or expert determination, both recognized by HHS as valid approaches to de-identification. This ensures that the data is no longer considered PHI, thereby minimizing privacy risks and regulatory exposure. This approach demonstrates a commitment to patient privacy and a proactive stance on compliance, which are foundational to ethical healthcare data management. An incorrect approach that involves directly sharing identifiable patient data for research without proper authorization or de-identification constitutes a direct violation of the HIPAA privacy rule. This failure to protect PHI can lead to significant penalties, reputational damage, and erosion of patient trust. Another incorrect approach, such as relying solely on internal data use agreements without a robust de-identification process, is insufficient because these agreements do not negate the need to de-identify PHI when it is no longer required for treatment, payment, or healthcare operations, and is being used for secondary purposes like research. Furthermore, an approach that assumes all research data is inherently de-identified without a formal process is a dangerous assumption that overlooks the detailed requirements for de-identification under HIPAA. Professionals should employ a decision-making framework that begins with identifying the intended use of the data. If the data is for treatment, payment, or healthcare operations, direct use of PHI may be permissible with appropriate safeguards. However, for secondary uses like research, quality improvement, or public health activities, the framework must then assess whether the data can be used in its identifiable form, e.g., with patient authorization, or if it must be de-identified. If de-identification is required, the professional must choose between the safe harbor method or expert determination, ensuring the chosen method meets HIPAA standards. This systematic approach ensures that all privacy and security obligations are met before data is accessed or shared. Question 8. Risk assessment procedures indicate that a healthcare provider is considering sharing aggregated, de-identified patient data with a public health agency for a study on disease trends. The provider has removed direct identifiers such as names, addresses, and social security numbers. However, the dataset still contains detailed demographic information and specific diagnoses that, when combined with other publicly available data, could potentially allow for the re-identification of individuals. Which of the following approaches best aligns with HIPAA requirements for data sharing in this context? Option A. Engage a qualified expert to perform an expert determination for de-identification, or ensure the data meets the safe harbor method requirements by removing all 18 identifiers and ensuring no residual risk of re-identification. Option B. Obtain explicit written authorization from each patient whose data is included in the dataset before sharing it with the public health agency. Option C. Proceed with sharing the data as is, assuming that removing direct identifiers is sufficient for de-identification under HIPAA. Option D. Share the data with the public health agency under the assumption that disclosures to public health authorities for disease trend analysis are always permitted without further safeguards. The correct answer is C. Proceed with sharing the data as is, assuming that removing direct identifiers is sufficient for de-identification under HIPAA. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the imperative for data sharing to improve patient care and public health initiatives with the stringent privacy protections mandated by HIPAA. The complexity arises from identifying appropriate legal bases for sharing, ensuring de-identification or anonymization standards are met, and managing the risks associated with potential re-identification, especially when dealing with sensitive health information. Navigating these competing interests demands a thorough understanding of HIPAA privacy rule and its specific provisions regarding permitted uses and disclosures. Correct approach analysis. The correct approach represents best professional practice because it directly addresses the core requirements of HIPAA for data sharing. It prioritizes obtaining patient authorization or ensuring the data is properly de-identified according to HIPAA safe harbor or expert determination methods before sharing. This aligns with the principle of minimum necessary disclosure and respects individual privacy rights. Furthermore, it involves establishing robust data use agreements that clearly define the permitted uses and security safeguards for the shared data, thereby mitigating risks of unauthorized access or disclosure. This proactive and compliant approach ensures that data sharing serves its intended purpose without violating patient privacy or regulatory mandates. Incorrect approaches analysis. One incorrect approach involves sharing identifiable patient data with a research institution without explicit patient authorization or a valid HIPAA waiver of authorization. This directly violates the HIPAA privacy rule, which requires patient consent for most uses and disclosures of protected health information. For research purposes. It fails to uphold the principle of patient autonomy and privacy. Another incorrect approach is to assume that de-identifying data by simply removing names and addresses is sufficient. HIPAA has specific standards for de-identification, safe harbor, or expert determination. Merely removing obvious identifiers may not adequately protect against re-identification, especially when combined with other publicly available information. This approach risks a breach of privacy and non-compliance with HIPAA de-identification requirements. A third incorrect approach is to share data with a public health agency based solely on the perceived public good, without verifying if the specific disclosure is permitted under HIPAA or if a business associate agreement (BA) is in place if the agency is not a covered entity or a public health authority acting in its official capacity. While public health activities are a permitted use under HIPAA, the specific circumstances and the nature of the disclosure must align with the regulation's provisions, and appropriate safeguards must be in place. Professional reasoning. Professionals should approach data sharing by first identifying the purpose of the sharing and the nature of the data. They must then consult HIPAA privacy rule to determine the appropriate legal basis for disclosure, which may include patient authorization, a waiver of authorization, de-identification, or a permitted use/disclosure, e.g., for public health activities, research under specific conditions. If sharing identifiable data, a BAA is often required if the recipient is a business associate. For de-identified data, adherence to safe harbor or expert determination methods is crucial. Documenting the rationale for each disclosure and implementing robust security measures are essential steps in ensuring compliance and protecting patient privacy. Question 9. Process analysis reveals that a healthcare organization is experiencing a consistent rate of data entry errors in patient demographic and clinical information. These errors, while often minor, have the potential to impact downstream clinical decision-making and billing accuracy. The organization is seeking to implement a strategy to enhance the integrity and accuracy of its patient data. Which of the following approaches best aligns with the requirements for maintaining data integrity under the Health Insurance Portability and Accountability Act, HIPAA? Option A. Implement a comprehensive data governance program that includes regular data audits, automated validation checks at the point of entry, and clearly defined procedures for error correction and staff training on data accuracy protocols. Option B. Assign a single, dedicated data integrity specialist to review all patient records for accuracy on a weekly basis, without implementing system-wide changes to the data entry process. Option C. Focus on training staff to be more careful during data entry and implement a system for correcting errors only when they are reported by patients or other departments. Option D. Prioritize the speed of data entry to ensure all patient information is captured quickly, with the understanding that errors will be addressed as they are identified through routine quality control checks. Correct answer is A. Implement a comprehensive data governance program that includes regular data audits, automated validation checks at the point of entry, and clearly defined procedures for error correction and staff training on data accuracy protocols. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the imperative of maintaining accurate patient data with the practicalities of data entry and correction in a busy healthcare environment. The potential for errors in patient records is high due to manual input, system interfaces, and the sheer volume of information processed daily. A failure to ensure data integrity can lead to misdiagnosis, inappropriate treatment, billing errors, and breaches of patient privacy, all of which have significant legal, financial, and ethical ramifications under HIPAA. Correct approach analysis. The correct approach emphasizes proactive measures and a systematic process for data integrity. This aligns with HIPAA security rule, which mandates administrative, physical, and technical safeguards to protect the confidentiality, integrity, and availability of electronic protected health information, E5. Specifically, implementing regular audits, validation checks, and clear procedures for data correction directly addresses the need for accuracy and completeness. This approach fosters a culture of data stewardship, where all staff understand their role in maintaining high-quality information, thereby minimizing risks and ensuring compliance. Incorrect approach is analysis. One incorrect approach focuses solely on reactive correction after errors are identified. While correction is necessary, relying only on this reactive stance fails to implement preventative controls, increasing the likelihood of ongoing errors and potential harm. This approach neglects the proactive requirements of the HIPAA security rule for safeguarding data integrity. Another incorrect approach prioritizes speed of data entry over accuracy. This directly contravenes the principle of data integrity. HIPAA requires that EPHI be accurate and complete. Prioritizing speed at the expense of accuracy can lead to significant downstream consequences, including patient safety issues and potential violations of HIPAA privacy rule if inaccurate information is disclosed or used inappropriately. A third incorrect approach involves delegating data integrity checks to a single individual without a broader organizational framework. While that individual might be diligent, this creates a single point of failure and does not embed data integrity as a core organizational responsibility. HIPAA emphasizes organizational policies and procedures, not sole reliance on individual efforts, for safeguarding protected health information. Professional reasoning. Professionals should adopt a risk-based approach, identifying critical data elements and implementing controls commensurate with the potential impact of inaccuracies. This involves establishing clear policies and procedures for data entry, validation, and correction. Regular training for staff on data integrity best practices and HIPAA requirements is crucial. Furthermore, leveraging technology for automated checks and balances, coupled with periodic manual audits, provides a robust framework for maintaining accurate and reliable patient data. This systematic and layered approach ensures both compliance and the delivery of high-quality patient care. Question 10. During the evaluation of a research proposal requesting access to patient data, a covered entity's privacy officer is determining the appropriate method for de-identifying the data to permit its use for secondary research purposes. The proposal involves a large dataset containing demographic information, treatment details, and outcomes for a specific patient population. The privacy officer is considering several approaches to de-identify this data in compliance with HIPAA. Which of the following approaches best ensures compliance with HIPAA de-identification requirements for this scenario? Option A. Engaging a statistician to perform a general assessment of the data's anonymity without specifically applying the safe harbor or expert determination methodologies. Option B. Removing all 18 identifiers specified in the HIPAA safe harbor de-identification method, ensuring that no unique identifying information remains in the dataset. Option C. Removing only the patient's name, address, and date of birth, as these are the most common identifiers. Option D. stripping all direct identifiers and assuming the data is de-identified because it is being used for research and the researchers have signed a data use agreement. The correct answer is B. Removing all 18 identifiers specified in the HIPAA safe harbor de-identification method, ensuring that no unique identifying information remains in the dataset. Explanation: this scenario is professionally challenging because it requires balancing the need for data utility and research with the stringent privacy protections mandated by HIPAA. The core tension lies in determining when de-identified data is sufficiently protected to be shared without patient authorization, a determination that hinges on adherence to specific HIPAA de-identification standards. Careful judgment is required to avoid both oversharing protected health information, FI, and hindering valuable research. The correct approach represents best professional practice because it meticulously follows the HIPAA safe harbor method for de-identification. This method, outlined in 45 CFR Section 164, 514b, 2, provides a safe and legally compliant pathway for de-identifying PHI. By removing all 18 specified identifiers, the covered entity ensures that the resulting data cannot be used to identify individuals, thereby eliminating it as PHI and allowing for its use for research purposes without further authorization. This aligns directly with the privacy rule's intent to permit the use of de-identified data for beneficial purposes while safeguarding individual privacy. An incorrect approach that relies solely on removing common identifiers like names and addresses, but fails to address all 18 HIPAA identifiers, is professionally unacceptable. This approach risks re-identification, as other combinations of remaining data points could still indirectly identify an individual. This constitutes a direct violation of HIPAA definition of de-identification and the privacy rule's requirements for protecting PHI. Another incorrect approach that attempts to use expert determination without a thorough understanding of the methodology or without engaging a qualified expert is also professionally unacceptable. While the expert determination method, 45 CFR Section 164, 514b, 3, is a valid alternative to safe harbor, it requires a rigorous statistical or scientific assessment by an individual with appropriate expertise to conclude that the risk of re-identification is very small. A superficial application of this method fails to meet the regulatory standard and exposes the covered entity to significant compliance risk. A further incorrect approach that assumes any data stripped of direct identifiers is automatically de-identified without considering indirect identifiers or the potential for linkage with other datasets is also professionally unacceptable. HIPAA de-identification standards are comprehensive and require consideration of all potential means of identification. Failure to do so demonstrates a lack of due diligence and a misunderstanding of the regulatory requirements. A professional decision-making process for similar situations should involve a clear understanding of the applicable HIPAA de-identification standards, safe harbor, and expert determination. Covered entities should first assess whether the safe harbor method can be applied. If so, they should meticulously remove all 18 specified identifiers. If safe harbor is not feasible or desirable, they should consider the expert determination method, ensuring the engagement of a qualified expert and a robust, documented assessment. Throughout the process, a risk-based approach should be maintained, focusing on the likelihood of re-identification and the potential harm to individuals. Documentation of the de-identification process is crucial for demonstrating compliance. Question 11. Benchmark analysis indicates that a healthcare provider is reviewing its data classification policies to ensure compliance with HIPAA. The organization handles a wide range of patient information, including appointment schedules, billing records, and diagnostic imaging reports. Which of the following approaches best reflects the comprehensive understanding of healthcare data types requiring privacy protections under HIPAA? Option A. Focusing protection efforts primarily on data explicitly listed in HIPAA breach notification rules, considering other data types as less critical for privacy controls. Option B. Differentiating data protection levels based on the perceived sensitivity of the information, with only highly sensitive data like genetic test results or mental health notes receiving the strictest controls. Option C. Classifying all data that can be linked to an individual patient, regardless of its perceived sensitivity, as protected health information, FI, requiring full HIPAA safeguards. Option D. Implementing de-identification techniques on all aggregated patient data before storage, assuming this automatically removes it from HIPAA purview without further assessment. The correct answer is C. Classifying all data that can be linked to an individual patient, regardless of its perceived sensitivity, as protected health information. Phi, requiring full HIPAA safeguards. Explanation. This scenario presents a professional challenge because healthcare organizations routinely handle a wide spectrum of protected health information. Phi, each with varying levels of sensitivity and regulatory scrutiny under HIPAA. The core difficulty lies in accurately categorizing and applying appropriate safeguards to different types of PHI, especially when data is aggregated or de-identified. Careful judgment is required to ensure compliance and protect patient privacy without unduly hindering legitimate data use for healthcare operations, research, or public health. The correct approach represents best professional practice because it aligns with the fundamental principles of HIPAA privacy rule, which mandates the protection of all individually identifiable health information. Specifically, it recognizes that even seemingly less sensitive data, when linked to an individual, becomes PHI and requires the same level of protection as more sensitive data like genetic information or substance abuse treatment records. This approach ensures a comprehensive privacy program that addresses all potential risks to PHI, thereby upholding ethical obligations and regulatory requirements. An incorrect approach that fails to recognize the broad definition of PHI under HIPAA would be professionally unacceptable. For instance, treating only highly sensitive data types as requiring strict protection, while overlooking less sensitive, but still identifiable information, creates significant privacy vulnerabilities. This would constitute a regulatory failure under HIPAA, as the law defines PHI broadly to include any information that relates to the past, present, or future physical or mental health or condition of an individual, the provision of healthcare to an individual, or the past, present, or future payment for the provision of healthcare to an individual, and that identifies the individual, or there is a reasonable basis to believe the information can be used to identify the individual. Ethically, it breaches the trust placed in healthcare providers to safeguard all patient information. Another incorrect approach might involve over-de-identification, where data is stripped of identifiers, but still retains a high risk of re-identification due to the combination of data points. This would also be a regulatory failure, as HIPAA outlines specific standards for de-identification, safe harbor, and expert determination methods that must be met to remove PHI status. Failure to adhere to these standards means the data remains PHI and subject to HIPAA protections. Ethically, it demonstrates a lack of diligence in protecting patient privacy. The professional decision-making process for similar situations should involve a thorough understanding of HIPAA definitions of PHI and its various categories. This includes recognizing that the sensitivity of the data is less important than its identifiability. Professionals should consult HIPAA regulations, guidance from the Office for Civil Rights (OCR), and internal policies to ensure accurate data classification. When in doubt, erring on the side of greater protection is always the prudent course of action. A risk assessment framework should be applied to all data types to identify potential vulnerabilities and implement appropriate administrative, physical, and technical safeguards. Question 12. The assessment process reveals that a healthcare organization is utilizing a combination of security measures for its electronic protected health information (EFI). While strong access controls are in place for internal systems and physical security of server rooms is robust, the organization transmits patient data to a third-party billing service via email and stores archived patient records on external hard drives that are not encrypted. What is the most appropriate course of action to ensure compliance with federal healthcare privacy regulations? Option A. Focus solely on enhancing physical security measures for server rooms and implement stricter password policies for internal access. Option B. Continue transmitting unencrypted patient data via email to the billing service, but include a disclaimer in each email stating that the information is confidential. Option C. Rely on the existing strong access controls and physical security measures, as these are sufficient to protect ePHI from unauthorized access. Option D. Implement encryption for all ePHI stored on external media and transmitted via email, in addition to maintaining existing access controls and physical security measures. The correct answer is D. Implement encryption for all ePHI stored on external media and transmitted via email, in addition to maintaining existing access controls and physical security measures. Explanation: the assessment process reveals a common challenge in healthcare privacy compliance, balancing the need for efficient data access and transmission with robust security measures. This scenario is professionally challenging because it requires a nuanced understanding of how different security protocols impact both data integrity and the operational workflow of healthcare providers. The core tension lies in selecting security methods that are both effective against evolving threats and practical for daily use, without compromising patient privacy or regulatory adherence. Careful judgment is required to avoid over-securitization that hinders legitimate access or under-securitization that exposes sensitive patient information. The correct approach represents best professional practice because it prioritizes the use of encryption for data both at rest and in transit, aligning directly with the Health Insurance Portability and Accountability Act (HIPAA) security rule. Specifically, the HIPAA security rule mandates the implementation of technical safeguards to protect the confidentiality, integrity, and availability of electronic protected health information. E-Fi. Encryption is a fundamental technical safeguard that renders ePHI unreadable and indecipherable to unauthorized individuals, thereby meeting the requirements for data integrity and confidentiality during storage and transmission. This approach ensures that even if data is intercepted or accessed without authorization, it remains protected. An incorrect approach that relies solely on access controls without encryption fails to meet the regulatory requirements. Access controls, while essential, only restrict who can access the data. They do not protect the data itself if an unauthorized individual gains access through a compromised credential or a system vulnerability. This would be a violation of HIPAA requirement for safeguarding ePHI against unauthorized access, use, or disclosure. Another incorrect approach that involves transmitting unencrypted data over public networks, even with a disclaimer, is a direct contravention of HIPAA. The HIPAA security rule explicitly requires that ePHI be protected during transmission. Public networks are inherently insecure, and transmitting sensitive health information without encryption exposes it to significant risks of interception and unauthorized disclosure, leading to potential breaches and violations. A third incorrect approach that focuses only on physical security of servers while neglecting data transmission security is also insufficient. While physical security is a component of the HIPAA security rule, it does not address the risks associated with data moving between systems or locations. Data transmission security is a distinct and critical technical safeguard that must be addressed independently. The professional reasoning process for making decisions in such situations should involve a risk assessment framework. This framework requires identifying potential threats to ePHI, evaluating the vulnerabilities in current systems and processes, and determining the likelihood and impact of a breach. Based on this assessment, appropriate safeguards, including technical, physical, and administrative safeguards, should be implemented. Professionals must consult relevant regulations, such as HIPAA, and industry best practices to ensure that chosen security measures are compliant and effective. Regular review and updates to security protocols are also crucial to adapt to new threats and technological advancements. Question 13. Regulatory review indicates that a healthcare organization wishes to conduct a retrospective research study on a rare disease using patient records. The study requires access to detailed clinical information, including diagnoses, treatment histories, and genetic markers. Due to the rarity of the disease and the retrospective nature of the study, it is not practicable to obtain individual patient authorization for the use of their PHI. The organization's research team has proposed several approaches to proceed. Which of the following approaches best aligns with the requirements of the HIPAA privacy rule for using PHI for research purposes under these circumstances? Option A. Delay the research indefinitely until a method for obtaining individual patient authorization for all past records can be developed to ensure absolute compliance. Option B. Proceed with the research using data that has been de-identified according to the safe harbor method, ensuring that all 18 identifiers are removed, even if this level of de-identification might limit the depth of analysis required for the study. Option C. Obtain a waiver of authorization from the Institutional Review Board or a privacy board, demonstrating that the research could not practicably be carried out without the waiver and that the privacy risks have been minimized. Option D. Utilize the PHI for the research study without seeking any form of patient authorization or waiver, as the research is for a rare disease and deemed to be in the public interest. The correct answer is C. Obtain a waiver of authorization from the Institutional Review Board or a privacy board, demonstrating that the research could not practicably be carried out without the waiver and that the privacy risks have been minimized. Explanation. This scenario presents a common implementation challenge in healthcare privacy compliance, balancing the need for data access for legitimate healthcare operations with the stringent requirements for patient consent and data de-identification. The professional challenge lies in interpreting the nuances of the Health Insurance Portability and Accountability Act, HIPAA, privacy rule, specifically regarding the use and disclosure of protected health information. For research purposes, when direct patient consent is not feasible or has not been obtained, careful judgment is required to determine when a waiver of authorization is permissible and how to properly implement it, ensuring patient privacy is protected while still enabling valuable research. The correct approach represents best professional practice because it directly addresses the regulatory requirements for using PHI for research without individual authorization. Specifically, it involves obtaining an Institutional Review Board or a privacy board waiver of authorization. This is a well-established mechanism under HIPAA, 45 CFR Section 164, 512I, that allows covered entities to use or disclose PHI for research purposes if the IRB or privacy board determines that the research could not practicably be carried out without the waiver, and that the privacy risks to individuals have been minimized. This approach demonstrates a commitment to both advancing medical knowledge and upholding patient privacy rights, adhering to the spirit and letter of the law. An incorrect approach that involves proceeding with the research using de-identified data without confirming its adequacy for the research purpose is professionally unacceptable. While de-identification is a valid method for reducing privacy risks, the HIPAA standard for de-identification, 45 CFR Section 164, 514b, requires that the information be rendered such that it cannot be used to identify an individual. If the de-identification is insufficient for the specific research needs, it could still inadvertently lead to re-identification, violating the privacy rule. Another incorrect approach, using the PHI without any form of authorization or waiver, is a direct violation of HIPAA. The privacy rule generally requires patient authorization for the use and disclosure of PHI for research, unless a specific exception, such as a waiver of authorization, applies. Proceeding without this would expose the covered entity to significant penalties. Finally, an incorrect approach of delaying the research indefinitely due to the complexity of obtaining consent or a waiver is also professionally problematic. While caution is necessary, an indefinite delay can hinder important research that could benefit public health. The professional decision-making process should involve a thorough understanding of the available regulatory pathways, consultation with legal counsel and ethics boards, and a proactive approach to implementing compliance solutions rather than avoiding the issue. Question 14. The evaluation methodology shows that a healthcare organization is preparing to contract with a new third-party vendor to manage its patient billing and claims processing. This vendor will require access to a significant volume of patient demographic information and health insurance details. What is the most critical step the healthcare organization must take to ensure compliance with HIPAA regarding this arrangement? Option A. Rely on the vendor's existing privacy policy, assuming it meets all federal healthcare privacy standards. Option B. Obtain a signed business associate agreement (BA) that clearly defines the vendor's obligations for safeguarding protected health information (FI) and includes provisions for breach notification and data security. Option C. Negotiate a lower service fee for the billing and claims processing, prioritizing cost savings over detailed contractual privacy clauses. Option D. Proceed with the contract without a BAA, assuming the vendor's standard service agreement implicitly covers privacy obligations. The correct answer is B. Obtain a signed business associate agreement (BA) that clearly defines the vendor's obligations for safeguarding protected health information (FI) and includes provisions for breach notification and data security. Explanation: the evaluation methodology shows that a healthcare provider is considering engaging a new cloud-based electronic health record (EHR) vendor. This scenario is professionally challenging because the vendor will have access to protected health information (PHI), making them a business associate under HIPAA. Ensuring a robust business associate agreement (BA) is critical to protect patient privacy and comply with federal regulations. The provider must carefully assess the vendor's security practices and ensure the BAA adequately addresses all HIPAA requirements, including data breach notification, permitted uses and disclosures, and the obligation to return or destroy PHI upon termination of the agreement. The correct approach involves meticulously reviewing the proposed BAA to ensure it explicitly outlines the vendor's responsibilities for safeguarding PHI, aligns with the provider's privacy policies, and meets all minimum requirements stipulated by the HIPAA privacy and security rules. This includes verifying that the BAA mandates appropriate administrative, physical, and technical safeguards, requires timely notification of breaches, and establishes clear termination clauses. This approach represents best professional practice because it proactively mitigates privacy risks, ensures regulatory compliance, and upholds the provider's ethical duty to protect patient information. An incorrect approach would be to assume that a standard BAA provided by the vendor is sufficient without thorough review. This fails to acknowledge the provider's ultimate responsibility for ensuring their business associates comply with HIPAA. Another incorrect approach is to focus solely on the cost of the EHR system and overlook the critical privacy and security provisions within the BAA. This prioritizes financial considerations over patient privacy, a significant ethical and regulatory failure. Lastly, neglecting to define the specific types of PHI the vendor will access and the permitted uses and disclosures in the BAA is a critical oversight. This ambiguity can lead to unauthorized access or use of PHI, violating HIPAA core principles. Professionals should employ a decision-making framework that prioritizes regulatory compliance and patient privacy. This involves a thorough risk assessment of any third-party vendor handling PHI, followed by a detailed review of the BAA to ensure it is comprehensive and legally sound. Engaging legal counsel specializing in healthcare privacy law is advisable to validate the BAA's adequacy. Continuous monitoring of business associate compliance and regular BAA reviews are also essential components of a robust privacy program. Question 15. Quality control measures reveal that a third-party vendor, with whom a covered entity has a business associate agreement, experienced a ransomware attack that may have resulted in unauthorized access to electronic protected health information (EPHI) of the covered entity's patients. The vendor has provided a preliminary assessment suggesting the attack was contained and that only a limited number of patient records were potentially accessed. They are still investigating the full extent. What is the most appropriate immediate course of action for the covered entity's privacy officer? Option A. Conduct an internal audit of the covered entity's own systems to ensure no similar vulnerabilities exist, without engaging further with the vendor until their investigation is complete. Option B. Instruct the vendor to immediately cease all operations and terminate the business associate agreement to mitigate further risk. Option C. Initiate a formal breach risk assessment in accordance with High-Tech Act requirements to determine if a reportable breach has occurred and prepare for potential notification obligations. Option D. Rely on the vendor's preliminary assessment and wait for their final report before taking any further action to avoid unnecessary disruption. The correct answer is C. Initiate a formal breach risk assessment in accordance with High-Tech Act requirements to determine if a reportable breach has occurred and prepare for potential notification obligations. Explanation: scenario analysis. This scenario is professionally challenging because it involves a direct conflict between the operational needs of a healthcare provider to utilize new technology for improved patient care and the stringent privacy and security mandates of the High-Tech Act. The rapid adoption of health information technology, while beneficial, introduces complex risks related to the privacy and security of protected health information. 5. A privacy professional must navigate these risks to ensure compliance without hindering innovation. The core challenge lies in balancing the benefits of technology with the absolute requirement to safeguard patient data, especially when a breach has already occurred. Correct approach analysis. The correct approach emphasizes a comprehensive, proactive, and compliant response to a potential breach. This involves immediately assessing the scope and nature of the unauthorized access, determining if it constitutes a reportable breach under HITECH, and then executing the required notification procedures to affected individuals, the Secretary of HHS, and potentially the media. This approach aligns directly with the breach notification requirements outlined in the HITECH Act, which mandate timely and specific actions to mitigate harm and inform those whose PHI may have been compromised. It demonstrates a commitment to transparency and accountability, which are fundamental to maintaining patient trust and regulatory compliance. Incorrect approaches analysis. One incorrect approach focuses solely on internal remediation without considering the mandatory external notification requirements. This fails to acknowledge the HITECH Act's explicit stipulations for breach notification, which are designed to protect individuals and hold covered entities accountable. Ignoring these requirements can lead to significant penalties and reputational damage. Another incorrect approach involves a superficial assessment of the incident, concluding it's not a breach without a thorough investigation. HITECH Act defines a breach broadly, and a hasty, unsubstantiated determination can result in noncompliance if the incident actually meets the definition of a breach. This approach risks underreporting and failing to protect individuals. A third incorrect approach prioritizes minimizing disruption and cost over immediate compliance. While operational efficiency is important, it cannot supersede legal and ethical obligations to protect patient privacy. Delaying or downplaying a potential breach to avoid inconvenience or expense is a direct violation of the HITECH Act's intent and can exacerbate the consequences of a breach. Professional reasoning. Professionals should employ a structured decision-making framework when faced with potential privacy incidents. This framework should include 1. Incident identification and triage. Promptly recognize and assess any potential unauthorized access or disclosure of PHI. 2. Risk assessment. Conduct a thorough investigation to determine the nature, scope, and likelihood of harm resulting from the incident, referencing the HITECH Act's breach risk assessment factors. 3. Compliance determination. Based on the risk assessment, definitively determine if the incident meets the definition of a breach under HITECH. 4. Remediation and notification. If a breach is confirmed, implement corrective actions and execute all required notifications to affected individuals, HHS, and the media within the specified timeframes. 5. Documentation and review. Meticulously document all steps taken and conduct post-incident reviews to improve future incident response. Question 16. Implementation of a robust data access control and permission strategy within a healthcare organization following a comprehensive risk assessment is most effectively achieved by Option A. Relying on individual user discretion to only access PHI they deem necessary for patient care, with no formal access control mechanisms in place. Option B. Establishing role-based access controls that grant users access only to the minimum necessary PHI required for their specific job functions, with regular audits to verify adherence. Option C. Providing all clinical staff with broad access to all patient records to ensure they can provide timely care, with periodic manual reviews of access logs. Option D. Implementing a single, universal access level for all users across the organization to simplify management and ensure no one is inadvertently denied access. The correct answer is B. Establishing role-based access controls that grant users access only to the minimum necessary PHI required for their specific job functions, with regular audits to verify adherence. Explanation. This scenario is professionally challenging because it requires balancing the need for efficient access to protected health information, for legitimate healthcare operations with the fundamental obligation to protect patient privacy and comply with stringent federal regulations. The complexity arises from defining appropriate access levels, ensuring they are consistently applied, and auditing their effectiveness without hindering critical patient care. A risk assessment approach is crucial to systematically identify potential vulnerabilities and implement proportionate controls. The correct approach represents best professional practice because it directly addresses the core principles of the Health Insurance Portability and Accountability Act, HIPAA, privacy and security rules. A risk assessment allows for tailored implementation of data access controls and permissions based on the specific functions and roles within the healthcare organization. This ensures that access is granted on a minimum necessary basis, aligning with the principle of least privilege. It also provides a documented, defensible strategy for compliance, demonstrating due diligence in protecting PHI. An incorrect approach that focuses solely on broad access for all clinical staff fails to adhere to the minimum necessary standard. This could lead to unauthorized access to PHI, increasing the risk of breaches and violating HIPAA. Granting access without a role-based justification, or without considering the specific data elements required for a particular function, is a direct contravention of privacy principles. Another incorrect approach that relies on infrequent, manual reviews of access logs without a proactive risk assessment is reactive rather than preventative. While auditing is important, it does not identify potential vulnerabilities before they are exploited. This approach misses opportunities to implement controls that could prevent unauthorized access in the first place, making it less effective in mitigating risk and demonstrating compliance. Finally, an approach that prioritizes convenience over security by implementing a single, universal access level for all users bypasses the fundamental security principle of granular access control. This creates an unacceptable level of risk, as individuals who do not require access to certain types of PHI would still have it, significantly increasing the likelihood of privacy violations and non-compliance with HIPAA security requirements. The professional decision-making process for similar situations should begin with a comprehensive understanding of the organization's data assets and the regulatory requirements. HIPAA. This should be followed by a thorough risk assessment to identify potential threats and vulnerabilities related to PHI access. Based on the risk assessment, a policy for data access controls and permissions should be developed, emphasizing the minimum necessary principle and role-based access. This policy should then be implemented, with ongoing monitoring, auditing, and regular reassessment of risks and controls to ensure continued compliance and effectiveness. Question 17. Stakeholder feedback indicates a growing concern regarding the organization's adherence to patient privacy regulations, particularly in light of recent legislative changes at the state level that appear to offer more robust protections than federal HIPAA requirements. The privacy officer needs to determine the most appropriate compliance strategy. Option A. Prioritize compliance with the state law if it offers greater privacy protections than HIPAA. Option B. Adhere strictly to HIPAA regulations, assuming they supersede all state-level privacy laws. Option C. Apply both federal and state laws concurrently without assessing which is more stringent. Option D. Implement compliance with the state law only when it is less stringent than HIPAA. The correct answer is A. Prioritize compliance with the state law if it offers greater privacy protections than HIPAA. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare privacy compliance within the United States, navigating the interplay between federal and state privacy laws. The Health Insurance Portability and Accountability Act, HIPAA, establishes a baseline for protected health information, privacy and security. However, many states have enacted their own privacy laws that may offer greater protections or cover entities not directly regulated by HIPAA. The professional challenge lies in identifying when state law preempts HIPAA, when HIPAA sets the minimum standard, and when both must be adhered to, creating a complex compliance landscape. This requires a nuanced understanding of both federal and state legal frameworks, and the ability to apply them to specific organizational contexts. Correct approach analysis. The correct approach involves a thorough analysis to determine if the state law provides greater privacy protections than HIPAA. If it does, the organization must comply with the more stringent state law. This aligns with the principle that HIPAA does not preempt state laws that are more stringent in their protection of privacy. This approach ensures the organization meets the highest applicable privacy standards, thereby minimizing the risk of privacy breaches and regulatory penalties, and upholding ethical obligations to protect patient information. Incorrect approach is analysis. One incorrect approach is to assume HIPAA always applies and supersedes all state laws. This fails to recognize that HIPAA explicitly allows for state laws that offer greater privacy protections. Adhering solely to HIPAA when a more stringent state law exists would lead to non-compliance with the state law, potentially resulting in fines, legal action, and reputational damage. Another incorrect approach is to apply the state law only when it is less stringent than HIPAA. This is fundamentally flawed because the goal of privacy compliance is to provide the highest level of protection. Ignoring a more protective state law in favor of a less protective federal standard would violate the spirit and letter of privacy regulations and ethical obligations. A third incorrect approach is to apply both federal and state laws without first determining which is more stringent. While seemingly cautious, this can lead to unnecessary compliance burdens and confusion. More importantly, it misses the critical step of identifying the governing standard when there is a conflict or difference in stringency, potentially leading to overlooking the most protective requirement. Professional reasoning. Professionals should approach this situation by first identifying all applicable federal and state privacy laws. Next, they must conduct a comparative analysis of these laws, specifically looking for provisions that offer greater privacy protections than HIPAA. This involves understanding the scope of each law, the types of entities and information they cover, and the specific requirements they impose. When a state law is found to be more stringent, it becomes the governing standard for the relevant aspects of privacy protection. This systematic, analytical approach ensures comprehensive compliance and upholds the highest ethical standards for patient privacy. Question 18. The audit findings indicate a pattern of significant delays in fulfilling patient requests to access their health information, with some requests taking longer than the 30-day timeframe permitted by HIPAA. The organization's privacy officer is concerned about potential HIPAA violations and patient dissatisfaction. Which of the following approaches best addresses this situation from a risk assessment perspective? Option A. Conduct a comprehensive review of the entire patient health information access process, from initial request to final delivery, to identify bottlenecks, procedural gaps, and training needs, and then develop targeted corrective actions based on the identified risks. Option B. Focus solely on upgrading the electronic health record system to improve data retrieval speed without investigating other potential causes for the delays. Option C. Advise patients that the 30-day timeframe is a guideline and that delays are sometimes unavoidable due to the complexity of retrieving health information. Option D. Immediately hire additional administrative staff to process patient requests, assuming that the current workload is the primary cause of the delays. The correct answer is A. Conduct a comprehensive review of the entire patient health information access process, from initial request to final delivery, to identify bottlenecks, procedural gaps, and training needs, and then develop targeted corrective actions based on the identified risks. Explanation. The audit findings indicate a potential breakdown in a healthcare organization's process for handling patient requests to access their health information. This scenario is professionally challenging because it directly impacts patient rights, regulatory compliance, and the trust between patients and providers. The organization must balance the patient's right to access with the need to protect privacy and ensure the accuracy and completeness of the information provided, all within the strict confines of HIPAA. The correct approach involves a thorough risk assessment to identify the root cause of the delays and potential breaches in the access process. This assessment should involve reviewing policies and procedures, staff training, technology used for information retrieval, and communication channels. By systematically evaluating these components, the organization can pinpoint specific vulnerabilities and develop targeted corrective actions. This aligns with the HIPAA privacy rules' emphasis on implementing safeguards to protect protected health information, PHI, and ensuring individuals' rights, including the right to access their PHI. A risk-based approach is fundamental to proactive compliance and mitigating potential harm to individuals and the organization. An incorrect approach would be to dismiss the audit findings as minor administrative oversights without further investigation. This fails to acknowledge the potential for systemic issues that could lead to repeated violations and significant harm to patients. It also neglects the proactive risk management required by HIPAA, which mandates organizations to identify and address potential vulnerabilities. Another incorrect approach would be to implement a quick fix, such as simply increasing staff to handle requests, without understanding the underlying reasons for the delays. This superficial solution may not address the core problems, such as inefficient workflows, inadequate technology, or insufficient training, and could lead to continued noncompliance and patient dissatisfaction. It bypasses the critical step of understanding the why behind the problem. Finally, an incorrect approach would be to focus solely on the technical aspects of information retrieval while neglecting the patient's experience and the communication surrounding the access request. HIPAA emphasizes not only the provision of information, but also the manner in which it is provided and the patient's understanding. Ignoring the human element in communication protocols can lead to frustration and a perception of noncompliance, even if the data is technically accessible. The professional decision-making process for similar situations should begin with a commitment to understanding the full scope of the issue. This involves actively listening to audit findings, engaging relevant stakeholders, including IT, privacy officers, and clinical staff, and conducting a comprehensive risk assessment. The assessment should guide the development of a remediation plan that is both effective and sustainable, prioritizing patient rights and regulatory compliance. Continuous monitoring and evaluation are also crucial to ensure the effectiveness of implemented solutions and to adapt to evolving risks and regulatory requirements. Question 19. The risk matrix shows a high likelihood of a ransomware attack with a moderate impact on patient care and a high impact on data confidentiality. Which of the following actions best prepares the organization for such an incident in accordance with HIPAA? Option A. Create a basic incident response checklist and rely on a third-party vendor to execute the entire incident response process without internal staff involvement. Option B. Implement advanced technical safeguards like intrusion detection systems and firewalls, assuming these will prevent all potential attacks. Option C. Develop and regularly test a comprehensive incident response plan that includes data backup, disaster recovery, and post-incident review procedures, and train staff on their roles. Option D. Wait for a security incident to occur before developing an incident response plan. Then engage external cybersecurity experts to manage the situation. The correct answer is C. Develop and regularly test a comprehensive incident response plan that includes data backup, disaster recovery, and post-incident review procedures, and train staff on their roles. Explanation. The risk matrix shows a high likelihood of a ransomware attack with a moderate impact on patient care and a high impact on data confidentiality. This scenario is professionally challenging because it requires balancing immediate operational needs with long-term privacy and security obligations under HIPAA. The organization must prepare for a significant event that could disrupt services and compromise sensitive patient information, necessitating a robust and well-rehearsed incident response plan. The correct approach represents best professional practice because it prioritizes the development and regular testing of a comprehensive incident response plan that aligns with HIPAA security rule requirements. Specifically, 45 CFR Section 164, 308A.6 I mandates that covered entities implement policies and procedures to address electronic data breaches. Furthermore, 45 CFR Section 164, 308A.6 Roman 2 requires a contingency plan that includes data backup and disaster recovery. A plan that includes regular tabletop exercises and post-incident reviews ensures that the organization can effectively detect, respond to, and mitigate breaches, minimizing harm to individuals and the organization, and facilitating timely notification as required by the Breach Notification Rule, 45 CFR Section 164, 400-414. An incorrect approach that focuses solely on technical safeguards without a defined response protocol fails to meet the regulatory mandate for a comprehensive incident response plan. This overlooks the procedural requirements of HIPAA, particularly the need for a structured approach to managing breaches once they occur. Another incorrect approach that delays the development of a plan until an incident occurs is a critical regulatory and ethical failure. HIPAA requires proactive planning, not reactive measures. Waiting for an incident to happen means the organization will be unprepared, leading to a delayed and potentially ineffective response, increasing the risk of further harm and non-compliance with breach notification timelines. A third incorrect approach that relies on external consultants to manage the entire incident response without internal training and defined roles creates a dependency that can hinder swift and effective action. While external expertise is valuable, the covered entity retains ultimate responsibility for compliance and must have internal capacity to manage incidents. This approach may also lead to a lack of institutional knowledge and preparedness for future events. Professionals should employ a decision-making framework that begins with a thorough risk assessment, as indicated by the risk matrix. This assessment should inform the development of a detailed incident response plan that addresses all phases of an incident: preparation, detection and analysis, containment, eradication, recovery, and post-incident activities. The plan must be regularly reviewed, updated, and tested through realistic exercises. Key personnel should be identified and trained on their roles and responsibilities. Finally, a process for continuous improvement, including lessons learned from exercises and actual incidents, should be embedded within the plan. Question 20. Investigation of a patient's request to amend their electronic health record reveals the patient wishes to remove a physician's documented assessment of their prognosis, stating it is unnecessarily negative. The healthcare organization has a policy for handling amendment requests that aligns with federal privacy regulations. What is the most appropriate risk assessment approach for the organization to take in responding to this request? Option A. Review the requested amendment to determine if the information is inaccurate or incomplete, and if the amendment is factually supported, process it. If the amendment is denied, document the specific reason for denial and inform the patient of their right to submit a statement of disagreement. Option B. Reject the amendment outright, as physician assessments of prognosis are considered expert opinions and are not subject to patient amendment requests. Option C. Automatically approve the amendment to remove the physician's assessment, as the patient's subjective feeling about the prognosis is a valid reason for modification to improve their emotional well-being. Option D. Ignore the request, as the patient's dissatisfaction with the medical assessment does not constitute a valid basis for amending a clinical record. The correct answer is A. Review the requested amendment to determine if the information is inaccurate or incomplete, and if the amendment is factually supported, process it. If the amendment is denied, document the specific reason for denial and inform the patient of their right to submit a statement of disagreement. Explanation. This scenario presents a professional challenge due to the inherent tension between a patient's right to amend their health record and the healthcare provider's obligation to maintain accurate and complete records, while also adhering to specific regulatory requirements. The provider must balance the patient's request with the integrity of the medical documentation and the legal framework governing such amendments. Careful judgment is required to ensure compliance without unduly hindering patient rights or compromising the medical record's reliability. The correct approach represents best professional practice because it directly addresses the patient's request within the established regulatory framework for amendments. It involves a thorough review of the requested amendment against the criteria for acceptance or denial, ensuring that any denial is based on legitimate, documented reasons that align with privacy regulations. This process upholds the patient's right to request amendments while maintaining the integrity and accuracy of the health record, as mandated by privacy laws. An incorrect approach that involves summarily rejecting the amendment without a documented, regulatory-compliant reason fails to uphold the patient's right to request amendments. This constitutes a regulatory failure, as it bypasses the required process for handling amendment requests. Another incorrect approach, which is to automatically approve any amendment request regardless of its factual basis or potential to alter the medical record's accuracy, represents an ethical and regulatory failure. This could lead to the creation of inaccurate or misleading health records, compromising patient care, and violating the principle of maintaining truthful documentation. A third incorrect approach, which is to ignore the request entirely, is a clear violation of privacy regulations that mandate a timely response to amendment requests. Professionals should employ a decision-making framework that begins with acknowledging the patient's request and understanding the specific regulatory requirements for health record amendments. This involves assessing the nature of the requested amendment, determining if it pertains to information that is inaccurate or incomplete, and evaluating whether the requested change is factually supported or constitutes an opinion or interpretation. If the request is denied, the provider must document the specific reasons for denial in accordance with regulatory guidelines and inform the patient of their right to submit a statement of disagreement.